Time for some clinical peanuts.
So I think I will just introduce all the speakers for today, and so this session, as everyone requested, is on FAICO, and especially we'll be focusing on the anterior segment part of it. So we have our speakers who are lined for who will talk us about cataract. Maybe Dr. Prasanna can share even a bit of about glaucoma as well, and Dr. Samir is there who will be talking again about his experience for FICO cataract, and he has recently cleared, so he's fresh with all the details. We have Dr. Prashant, who again will be talking about his FICO cataract experience, and Dr. Utkarsha, who will be talking about her experience in FICO, and we have Dr. Yugandhara. She has not yet joined, and she'll be talking about her experience in FAICO refractive. So I'll just introduce our speakers for today. We have first in line Dr. Prasanna Ramesh. So Dr. Prasanna Ramesh is a very well-known personality. So he's the research director and glaucoma head at Mahatma Eye Hospital, and he has both FICO glaucoma and FICO cataract with gold medal. Uh, he has published various chapters, books,
Anuj Soni.
and research articles, and he is the editor in chief of the book Oculus Res Geste. I don't know how to pronounce it, but
You are right. You are
yes,
right.
and he's the joint secretary for Young Ophthalmologic Society of India. And uh, thank you for joining in, Dr. Prasanna. Next,
Thank you.
we'd like to introduce Dr. Samir Chaudhary, who is a consultant at Arvind Madurai, and he's recently cleared his FICO cataract, and he's also a executive member of Young Ophthalmologic Society of India, and he's also published various books and chapters, and he's also received various awards in various competition for video and even excellence award for Rising Star. So thank you, Dr. Samir, for joining in. So do
Thank
we
you.
have
Thank you so much for the invite, sir.
Dr. Prashant has joined in? Dr. Prashant?
Sir.
Yes, yes, yes.
Yes, sir.
So,
I'm in.
yes, yes. So, Dr.
Shortly, I'll
Prash,
share my video.
please, you can also turn on your video so that everyone can,
Yes, sir.
yeah. So, Dr. Prashant is a fellow from Uma Clinic, and he's a consultant at DRR Eye Care Chennai. And he has also cleared his FAICO cataract, and he'll also share his experience. And do we have Dr. Utkarsha? So, Dr. Utkarsha has not yet joined, so we'll not waste
Yes, sir,
for.
I'm there.
Yes, yes, yes. So you can
Yes.
turn on your camera, Dr.
Yes.
Utkarsha. So Dr. Utkarsha Thakre is a consultant in Mumbai, and she is a fellow from Arvind in neuro-ophthalmology, and she has done her cataract and phaco fellowship from Shankara Eye Hospital, and she has also recently cleared a FAICO cataract. So she'll also share her experience on the same. So thanks for joining in, Dr. Utkarsha.
Thank
And
you, sir.
so we have one more speaker, Dr. Yugandhara. Whether we have her right now. So I think she'll join in little late. So Dr. Prasanna, yes, you can go ahead. We'll be
Thank
interested
you.
in getting more insights on the topic.
Thank you. Thank you, sir. Thank you. Thank you, Anuj sir, Samir, for having me here. I hope my screen is visible.
Yes.
And I'm
Yes,
audible
please.
also. Thank you. Thank you.
Yes.
So I'm Dr. Prasanna Venkatesh Ramesh, and I'll just take you through a very candid update. And thanks to Clinical Peanuts, Dr. Anuj sir, for having uh, a bunch of us here who have cleared FICO. I think next 5 minutes I'll just take some amount of your time so that I always felt having a PPT will articulate the points better. And FICO is an exam. I think next year you'll be getting these flyers for FICO and they'll have some specific instructions. Let's see some decoding of it. So why FICO? So FICO is an additional credential, proves excellence, credibility, recognition, opportunities. But another very important point which really helped personally me is if you are an academic person wants to present instructional courses or apply for travel grants, it gives a good CV credential and it helps you, get through those process. That is one practical point I felt, which I think will benefit all the attendees of today. And how do you go about it is you have to be a member of AAOS. You have to have a basic qualification, a DO or a DNB or an MD or an MS, which is mandatory, or any internationally recognized qualification, preferably. Minimum 2 years of experience, including the time spent in fellowship after completing your post-graduation is mandatory. Must have completed the subspecialty fellowship or at least 18 months. So this is what are the guidelines that they actually give you. And or you should at least have completed your senior residential, which is more, for example, you are going to go for a comprehensive category or something like that, or even cataract for that matter. Basically 2 years, or you can at least minimum is 18 months. So keep that in mind. And at least 3 years of practical experience, if you have, it really adds on to it. And the dates usually occurs at around September. So I think we are now having this discussion for next year. So make sure you are oriented towards the month of around August, September. That's when the mailers all start to come for the exams. Right. So examination center. Previously, when I was writing, we had only 4 or 5 centers, but now I think they're expanding it to 6, 7 centers. And these are some of the online return test centers: New Delhi, Mumbai, Kolkata, Bangalore, Chennai, and Hyderabad. And OSCE depends on which center that is actually available. It's totally different and subjected to availability. Examination fees in 10,000 rupees. You need to know how much the examination fees are charged because it is a payable. You have to pay a DD in favor of AIOS, which is again very important to keep in mind. The 3 stages are theory, OSCE, and Viva OC. No negative marking. So this is how it comes. This is one of my personal screenshots of my video. I first wrote FICO in 2019 for my glaucoma, and an official email ID will be sent to you regarding your confirmation. Where do you need to go? How do you need to, appear? This is actually a practical exam mail, whom to report and whatnot. So theory actually has 2 hours, 100 MCQs, no negative marking. Must know questions are 50%, moderate questions are 25%, hard is 25%. I personally have a lot of e-books with me too. If you want to, have the books, I can share it to you. The links of it, I honestly do it for the passion of teaching, and definitely reach out to me. I can do that. Second thing is OSCE, where you have 10 stages of OSCE. It depends whether the center is going to be, most of the centers actually tend to have a projector where they show the OSCE and then you need to, go about it, writing it down. But some centers, when 2019, when I wrote, you move from one area to another. And we had 2 patients, and you move from one area to the other, where you have two patients. We had 8 images. We had live stations, but now the trend is changing. Some centers have OSCEs where you sit in a place and they just show you the projection of it and go about it. Okay, that is something you need to keep in mind. Viva, last year I cleared my FAICO and I had 4 stations. So in 2019, when I went for glaucoma, again we had 4 stations. Nothing has really changed. If you're going for cataract, keep this in mind. Drug investigation instruments will be one, implant devices will be one, video clips will be a station. Another one can have a slide image or a pathological specimen or an iris hook, a CTS segment and something like that. Formative assessment, clinical and theory exam, a logbook evaluation. These are some things that in the syllabus you tend to have, as I was seeing the chat box as well, 18 months is something which is enough. At the same time, these are something that they give you in the rubrics of the exam. But when I wrote it even last year, I didn't have it. I think Samir can throw more light. Samir wrote it this year for FAICO when he talks. These are something that they give you in the syllabus, but I don't think there is much weightage shown to it. To summarize, my dear friends, 100 marks will go for your theory. Pass mark is 70%. Stage 2, then you will enter. Sometimes, for example, you are able to clear theory, but you are not able to not clear practicals. Don't need to worry. Next year, you will be only going for your practicals, not the theory. So that part you don't need to worry. So stage 2 will be 50% pass mark. OSCEs will be there for 100 marks. Viva OC will be there for 50 marks. Another formative assessment, which they say will be for another 50 marks. Apply online. This is the link that you need to use to apply online. And it's there available in AOS. This is a physical form that you will be downloading, and you can see the center preferences. It's a very straightforward and a very simple form. You don't need to really break your head around it. The instructions are all very to the point. What is your work experience? As Samir just answered, though in the syllabus it's quite confusing. There is 2 years and 3 years of practical experiences. 18 months is the thing. Don't need to get confused. 18 months is actually enough after you complete your residentship and go about applying this and move forward. Dr. Abhirami just asked about formative assessment. So formative assessment is something like a logbook. I'm just going back here. But when I went also, we didn't have it. So this is one syllabus where from the syllabus of AAOs, this is mentioned. You need to have a logbook evaluation, rubrics-based skill examination. And these are things which was not there when I did it. I don't think that is there even when Samir did it in 2025. I finished last year, January 2024. I was 23 batch, but I completed in January. We didn't have it, so don't break your head. And I can see Samir answering in the chat box that he was also not asked. So just forget about the formative assessment. It's still not there. Maybe it may be there in the next year, but as of now, till last year, it's not there. Okay. So this is the curriculum that you will get from the book. So this is my reference. The revised curriculum in the year 2024, I think they had a revised curriculum which was uploaded. And essential study materials, as I told, AO, E-OFTA, OFTO questions, ICO past questions, Digital Journal of Ophthalmology, PubMed, Ophthalmology exam, IDOCS. This is one of the major questions. Around 2000 questions are there. And important topics are biometry, aberrometry, corneal topography, phaco A to Z of phaco. That's very important. IOLs, again, A to Z, monofocals, monofocal plus, EDOF, premium lens, everything A to Z. Instruments, especially choppers, iris related instruments, be very well versed with it because these are very frequently used in day-to-day practices. So these are something which are very important. Theory topics like subluxation, uh, which happens quite common, drug-induced syndromes, pediatric cataracts, which we tend to, have a blind spot into it. Make sure you cover all this. Common complications, endophthalmitis, TAS, very important. Endophthalmitis, TAS, pseudophakic bullous keratopathy, striate keratopathy. Read all this. Intraoperatively, you need to know how to answer a PCR and a zonular dialysis management. And preferably, if you do some minimal procedures, biometry, YACAB, SICS, FAICO, at least a minimal procedure will give you a good orientation cognitively so you can be more practical. The examiners evaluate you in a practical way. They want to know whether you are practically oriented towards it so that they test your practical knowledge. So make sure you are oriented to these machines. And this is a very candid take of my journey. I started in glaucoma and I attempted FAICO glaucoma in 2019. And I did clear my glaucoma and my convocation happened in 2020. I took a break because I felt I was more a glaucoma surgeon, not fully well versed in cataract at that point in time. I took a break of around 5 years. Gradually began my FAICO journey. Started doing a lot of complex cataracts because in glaucoma you tend to have a lot of complicated cataracts. And these are some of my videos. I'm not going into the detail of it. A lot of complications, iris prolapse, PC rent, you need to manage all these things. And then I took my first attempt. 2020 October, I failed. So first attempt was quite tough. The portions and guidelines were quite different at those times. Uh, then again, you keep moving, right? You keep moving, you keep learning. This was again another attempt of an Argentinian flag. Not going into the detail, these are all in my YouTube channel. We did a lot of different innovative techniques of a donut rexus to reduce the intralenticular pressure. But again, again I failed. So, I mean, what I'm trying to say is, as a surgeon, I was evolving, but I was not able to crack the exams. That is what I wanted to candidly put here. So, December 2022, I had my second attempt. I was not able to. FICO Cataract was one of the toughest exams to clear, at least at that point in time. So again, you keep moving, you keep doing what you do. This was one of my zonular dialysis case. You can see the zonules were dialyzed, and I did a CTS to anchor the zonules. In this case, after I did a CTS, you can see the bag circled, and you keep doing what you do. That's your routine. Just keep doing what you do. The idea why I'm showing these things is keep doing and then keep attempting these exams. I'm not going into the surgical part for want of time. So in the third attempt is when I was able to clear. So if you guys are seeing this, just keep try again. Don't worry about failures. Failures are just part of life. And I was able to clear it with a gold medal in my third attempt. So the batch topper who tops it, they'll be given a medal. So that is the cherry on the cake that you get. And when I wrote, we had 34 members writing along with me. So if it's your time, it will happen. If you fail, it doesn't mean you are not a good surgeon. It's just that you are not oriented correctly to the exam. And you will always learn with your failures. And when your moment happens, you will come out with a gold medal. And this was my moment last year in Kolkata, where I was awarded the medal for my FICO journey. So now I have not only learned cataract, but I am still learning because there is no end to learning. I have my own fellowship program in my institute. We have trained 6 surgeons this year, and I think that's the font of teaching. You want to give back what you learned. And this is my last slide. So to conclude, my dear friends, it's a very prestigious degree. You do it for the zest of it, for the thirst of academic knowledge. And also it helps you in your travel grants and your instructional courses where CV matters. And eligibility is 18 months post-residentship. Leave the other part. There are so many things that shows in the website about formative assessment, practical assessment. Don't worry. As Samir told in the chat box, 18 months is your target. If you finished 18 months post-PG, apply it. 3 stages, theory, OSCE, Viva. Theory happens one shot, OSCE and Viva happens in another shot. Morning you'll have your OSCE in one day, and the same day afternoon you'll have 4 stations of Viva. So the formative and summative evaluations, they mark it along with the Viva and OSCE depending on how you answer. So ignore the fourth point. Preparation should cover theory, diagnostic, surgical, and complication management, giving importance to endophthalmitis, TAS, instruments, machinery, sterilization, autoclaving. These are some of the things which we miss out. Pediatric cataracts, which is again very important, and a lot of diagrams which we need to cover in Kansky. It helps you in your OSCE. So these are some of my take. And thank you, Clinical Peanuts. I'm following the work done by Dr. Anuj sir very closely. It's one of the fantastic works for the passion that I can see in him that he's doing for a lot of residents, young ophthalmologists, and for the ophthalmic community. And I am happy to share most of my study materials. You can reach to me on Instagram, mail ID, or on WhatsApp as well. My exam bank, exam questions, I don't mind it sharing because for the benefit of teaching, I think we all are here for it. And thank you. Thank you once again for this wonderful opportunity. Thank you. Samir? Yeah, Dr. Anuj,
Sure.
sir. Yeah.
Yeah. Okay. So thanks a lot, Dr. Prasanna. I think that was very comprehensive talk, and especially the you have shared your multiple attempts. So that is kind of sort of, as everyone has said, it's motivating to, because everyone feels like, oh, uh, why only me?
That's reality, sir.
Yes, yes. So I
That's
think
the reality.
we'll move on to Dr. Samir. And Dr. Samir, please share your experience, how it has been, and how did you go about the preparation part, and how it was different or similar to Dr. Prasanna's journey.
Uh, Thank you so much, sir. Are my slides visible?
Yeah.
Yeah. At the very outset, I would like to thank Anuj sir for giving me this opportunity. So, a very good evening to one and all. So, I'm Dr. Sami Chaudhary, and I'll be sharing my experience of giving the FICO cataract examination. So a very brief introduction about like who I am. So I completed my MS ophthalmology 2 years ago from Arvind Madurai. Currently working as a senior resident in general ophthalmology, about to finish, and I'll be joining as a VR fellow next year. And I have done a little bit of clinical research and done a decent number of cataract surgeries, and also served as a formal SICS and FACO trainer. So foremost, why you should give this examination? So obviously, it gives you a post nominal. It adds a degree to against your name. It adds to your CV, and also it also gives you recognition. So one of my another reasons that I wanted to give was recognition. So I always knew that I'll be going to do a retina fellowship, and fellowship degree with my name, no one would know that I'm capable or I have an expertise in cataract, doing cataract as well. So it actually gives you recognition that okay, it gives you projection that you are a cataract surgeon as well, and obviously it adds to your knowledge as well when you are preparing for the exam. For example, everyone would know about LOX 3 grading, lens opacification classification system, but that is actually barely anyone who uses it these days. So the one that we use, we grade nucleosclerosis NS1, NS2, NS3, NS4, but no one would definitely know the name of that particular classification. And that is when I was, preparing for the exam, I got to know that it is called Emery Little classification. And this is just an example, there's so much to learn, which is actually endless. So as already told, 18 months are required in that particular subspecialty application cost 10K. So the cutoff for this year was actually 75%, for 100 MCQs. It was a computer-based test. Practical again, 100 marks Viva, 100 marks Viva, and 100 marks OSCE. So it consists of total 200 marks. 50% is the passing, and my center was Narayana Nitrale, Bangalore. So coming to the reading material that I followed, so the three texts that I actually read quite extensively. So foremost was AAO, Volume 11, Lens and Cataract. The anatomy, embryology, biochemistry, physiology are must and are given very beautiful in this book. And also, I read about intraoperative and postoperative complications from that particular text. Then Steiner's, I read a lot of topics from Steiner's, the FAICO dynamics. I read about machines. So Arvind has, a lot of Alcon machines. So I made sure that, I read about active century, active fluidics, and so on. So I think Steiner's and AO are something which, you should read quite extensively, even if you're not giving this exam, just for your knowledge. And when it comes to biometry, so there was this book called on intraocular lens calculations, where the basics are given very nicely about both optical and ultrasound biometry. Then this was in a table that I had compiled for Noida Ophthalmology Times. It basically consists of all the commonly used IOLs in India, telling about the brand name, the company, the various features of a particular IOL, which stands them out, the powers that they are available, the haptic style, and so on. So this came very handy when I wanted to, just summarize or quickly go through the various intraocular lenses that are available in the market. And so these are my notes. So this is, I had spoken to, taken guidance from Prasanna sir only, and noted down all the important topics that were asked in practical and theory. And I made sure that, I went through all of them. So I had compiled all my reading material, the most important reading material, making more of a last minute revision notebook. And I made sure that I, go through this multiple times, especially over the last day. So, all the choppers, the images, this is the ultrasonic IOL cutter, radiation-induced cataract. And this is probably very important, the landmarks of different stages of lens development, PPC classifications, the pathogenesis, the genes, the risk of PCR, Lowy syndrome, Alport syndrome, sulfite oxidase deficiency, various biometers which are commercially available, then sound visual velocities, how is immersion different from applanation, what is the correction factor, the different ultrasound biometry scans, what is the error that is occurs with the amount of dioptric power that changes with zero point 0.1 mm error, comparison between Argos and this thing. This was a class which was taken for us for Argos and Clarion by Alcon people, so I had compiled the notes here itself. So a little bit about spherical aberration, IOL formulae, pediatric IOL calculation, which was asked again, NDI capsulotomy, and different phaco tips about balanced tip. Why is it called balanced? Why is it preferred now over different tips? What is the advantage? Then eye trace. So, it basically consists of what a very concise one single page notes about almost each and every topic that can be asked. The various intracameral drugs, gentamicin, moxifloxacin, epinephrine, bupivacaine, and so on. Then the facial blocks, CTR, iris hooks, capsule hooks. How is the CTR placed, implanted, Sioni ring, Henderson CTR. Then the various, nomenclature of ACIOL, various IOLs, Alcon, IOL cartridges, flags, the various steps of flags, and aniridia. So someone had told me from who had given the exam from NN that they were asked aniridic IOLs. So I read about aniridic and IOLs and aniridia as well quite extensively. And then bag in the lens, so acufocus, and so on. So diffractive optics or adipization. So basically, I had compiled a single notebook where I had added all these topics. So yeah, as told by Prasanna, so this was iDocs. So the cataract module of iDocs is, very, very handy, especially when you're giving the theory part. It has around 75 questions. So if you go through it, thoroughly, it will help you solve most of the questions, at least 50 to 60% that are going to be asked in the theory. So I read few articles as well. There was an article on eye trace from Delhi Journal of Ophthalmology, then about Varion and so on. So obviously, practical knowledge and experience matters a lot. Luckily enough, at Arvind we have access to everything: Argos, IL Master, iTrace, Verion, Alcon machines, and I have been given. I'm very grateful that I have been given a lot of hands-on as well. So I have dealt with subluxated cataracts, coloboma, different IOLs, and so on. So there was a question which was asked to me, on subluxated cataract. So how will you manage? How will you place a CTR? So that particular practical knowledge comes very, very handy. So timeline, actually 2 months of preparation is enough if you read even for 3 to 4 hours daily. For me, it was quite difficult because I was juggling between three exams. I had my ICU advanced, I had my retina fellowship exam, and I had my FICO cataract. So it's not that difficult if you dedicate 3 to 4 hours daily for 2 months. I think it should be enough. So just to recall few questions from theory. So they ask the concentration of hyaluronidase in blocks, the brand name of an IOL, the anterior chamber depth, the cutoff for a phakic IOL, the cell density cutoff for endothelial keratoplasties, soft shell technique, gene for posterior polar cataracts, rule of 9 for undercorrection of IOL if you place it in power of IOL if you place it in sulcus, pediatric IOL power calculation. They had given the age of the patient, the biometry value, and they had asked what would be the target refraction of that particular patient. They had asked on optical biometry, refractive indices of IOL, then differentiating factor of TARS from endophthalmitis. Then there was a question on PCR, chronic ENDOF, Schroeder's classification of PPC, components of biometry formula, like for example, and lens thickness, AC depth, and all are components of which IOL formula. Then aberration profile, whether it will be a spheric, neutral, negative spheric, negative, an IOL with negative spherical aberration or a positive spherical aberration following hyperopic classic PCO, and they had also asked about injectors. Coming to practical, they had given me capsule hooks, bupivacaine, Clarion IOL, and then they had asked me clinical scenarios. For example, the examiner had told, what if my grandmother comes with this, how will you manage? If she has ARMD, you end up doing a PCR, how will you manage? What IOL you would place? It went into, monovision, optic capture, and so on. Then they had shown me an image of specular microscopy as well, and they had asked me to diagnose it. Then what type of IOL you would, it was basically Fuchs, so they wanted to know which IOL you would not put. So it was an hydrophilic IOL. Why? Because in case the patient undergoes endothelial keratoplasty later on, you might have to leave intracameral gas, which might result in IOL calcification. Then biometry, keratoconus, injectors. They had shown me a pentacam of keratoconus. They asked me keratoconus specific formulae, which IOL you would place. They'd shown me injectors as well. Argos specific formulae they had asked, and obviously my experience, how many cataracts I have done, what type of cases I have done, and so on. Then coming to OSCE, there were two questions on ASOCT, one showing lens touch and PCR following intravitreal injection. There was an image of coloboma asking which conditions called bilateral coloboma, apple Miyake view, inverse hypopyon. Then they had asked about glaucoma as well, netasudil, what are the uses, what is the corneal degeneration it causes. There was an image of specular microscopy, and again, pentacam showing high astigmatism and how you would manage. Then there was one question on immersion biometry where they had asked labeled gates and they were asking what it was. OCT image showing DME, whether you would implant EDOF IOLs in this or not. And you can reach out to me for any queries, any reading material that is required. I'll be more than happy to help. And once again, I would like to thank Dr. Anuj sir for giving me this lovely opportunity. Thank you.
Thanks a lot, Samir. That was pretty amazing, and congratulations for your next journey. So from
Thank you,
FAICO
sir. Thank you.
Cataract, you proceed on to FAICO Red.
From where should I read? How should I prepare for my Viva and OSCE? So yes, and I think those videos have helped us a lot by Dr. Prasanna. So first of all, I would like to thank him also and Dr. Anuj sir for giving me this platform. So I don't have any this presentation. Just I would like to share my experience. What I felt like are the most important topics. Starting from for the theory exam. Personally, I feel like 65, around 60 to 65 questions will be from the must know and which you can easily answer. After that, those 20, 30 question will be like little tricky. Means you can eliminate two options, but then those other two will be little confusing. And the rest 10, 8 to 10 questions will be like no one else will know. No, even the examiners, I think it will be very difficult questions for them also to know. So first, I think we should target on the main volume, which is the 65 to 70% of the questions. Those will be from your anatomy. Uh, I think those questions will be, uh, you should know it thoroughly because these questions will be, if you know the questions. Otherwise, you cannot guess those questions. After that, you can go for Kansky images and all those things. And also cataract in complicated cases, like in subluxated cases, how to manage PCR, how will you CTR, CTS, all those things. They will directly put the images and ask you what those devices are or when you will use those devices, like in how much clock hours a D and all. So PCR, sublux, nucleus drop. Also, uh, all the matter was covered very well. Few things which I would like to include is cataract in myopia, high myopia, or in nano-ophthalmos, what precautions you have to take, what complications can be there. Also, there will be some case scenarios that you have this axial length, this IOL power number, but then intraoperatively you face these things. Next important topics will be biometers, definitely. Biometers and IL power calculation formulas. So the first, second, third, fourth generation, apart from those generations, what all differences will be there, what all new advances are there in those IL power calculation system, and also the biometers which are using those formulas. So which formulas exactly are those biometers using, and how will they efficiently help us? Next thing which I feel is refractive surgery, post-refractive surgery, what all IOL power calculation changes, what you'll have. So we had one question post-RK. Post-RK, will you go for clear corneal incision or you will go for a scleral tunnel? So if it is a 16 cut RK, then we have to go for a tunnel, scleral tunnel. But then if it is a 8 cut RK, then we can go for a clear corneal incision. So these some few very tricky questions which I got to know from is iFocus. iFocus is another medium from where you will get to know all these small questions. So whatever you feel, you read from AAO, BSCS, also Steiner's cataract surgery. The book is there. And apart from that, what I prepared from, like Dr. Samir had made his notes, even I had made all. I have compiled all those notes in one notebook, and then I have kept it for the last minute read. So that will be very helpful because in the last minute you cannot read all these bigger books. So this I will tell you for theory, and the OSCE thing. OSCE mein I felt कि they will keep little tricky because the very first question which they had kept for us was CTS. So CTS and iris hooks are very similar. So sorry, capsular tension hooks, yes. So only that image if they are putting, so you will get everyone in the room was confused. And the second question which they had put was a iris hook. So when you're giving the next question, you will question yourself, "Arey, this two questions back to back they'll not put." So again, similar ninth and 10th question, they had given us EDOFIL. Both the lengths were EDOFIL. One was VVT and another was, the next question was also on EDOFIL. So these things I would like to say for OSCE, these things you have to prepare very practically. While theory you can read from books, but then all the recent advances and everything they'll ask for OSCE. So I think if theory is cleared, half of your stress is gone because in those they'll ask you more of detailed questions, and um, also they'll ask you more of practical questions for OSCE. So that is what I will suggest everyone to do.
Thank you, Dr. Utkarsha, and thank you for joining in such a short time. So
Yes, sir. Thank you.
we just got to know about the result, so we got hold of Dr. Utkarsha. So that was really nice with the questions you shared because these are the points sometimes we tend to ignore and take it in the stride.
So
So
last, I would like
yeah,
to just
please.
add one thing. Pediatric IOL, like the rule of nine, they'll ask 100%. There will be one or two questions in OSCE also. There will be in Viva also. And also they like this iris implant very much. So 2-3 times back to back, I think they have added that question on iris implant. Either they'll show you the image and they'll ask you what is the name, and iris repair techniques. At least you should know you should identify the image with what is their names. So those things I would like to add.
Okay, sure. Thank you. So we have Dr. Prashant. Dr. Prashant Reddy, are you there?
Yes, sir.
Yeah, so sorry, please, how would you like to share your experience and how it was similar or different to, and how was your preparation?
Sure. So first of all, I would like to thank Dr. Anuj sir and Dr. Prasanna sir for giving me this opportunity. So myself, I'm Dr. Prashant from Chennai. I've completed my FAICO Refractive Fellowship from Umai Clinic, Chennai again. So currently, I'm working as a consultant, FAICO Refractive at DRR Care. So I think most of the theory part and the practical part the previous speakers have mentioned. So the books part, the videos, everything they have mentioned. So I think I don't have much to add from that. I'll just give a few tips where I think I could have scored more. And that's because this AO basic book that they have. So in that basic clinical sciences, they have this pharmacology, the drugs, the concentration, the formulations, the routes of administration. So it will come in handy when you're preparing for your OSCE sessions in the practical examination. And second thing was eye focus videos. So they give a lot of practical tips like which machines, which tips they use. So there's one Ekalavya Shankar Academy YouTube channel where they post their routine cases. So that thing gives a lot in handy. And there's one more book that I would like to mention is the Neil Friedman's book, where in detail, in depth of biometry they would have given. So I think that book is one book where you have to read the chapter of lens and cataract. And phaco-dynamics, as the previous speakers have suggested, I think that thing also should be mastered. And of course, the E of the books and the AO1 network MCQs will come in handy. And coming to the YouTube channels, I think most of you must be knowing. So that's Dr. Saurabh Patwardhan's channel, Dr. Deepak Nagur, Dr. Uday Devgan's. So they give a lot of tips that come in handy when they ask you practical questions. Like I had one of the examiners asking me, how do you manage IFIS? How would you do needle compression technique? How do you differentiate capsule hooks from iris hooks? So if you have done a couple of 100 procedures, so that then how do you make your incisions for iris hooks? They had asked me. So I think that will come in handy when you have done a few procedures and practicality, long tunnel, short tunnel, iris prolapse, how do you manage? So decompression in hypermature cataracts. That will give you a lot of edge while answering the questions. And then of course, the latest advances, IOLs, monovision concept, mini monovision, blended vision. So that they had asked me a lot. And finally, coming to IOLs, I think they have previous speakers have gone through most of it. And biometry, I think from keratoconus and PMD point of view, they had asked a lot of questions. Some of them which you will be able to answer, and very few of them you might not be able to. Like, for example, they had shown me a PMD image, 49-year-old NS2 cataract. How do you manage? So you have to go for a custom toric IOL, stability. So that kind of questions keep popping up. But then if you have gone through the proper procedure, if you have gone through the machines, if you had used them regularly, if you had used the Barrett Universal, how to use it post RK, if you had incorporated that into your practice, I think most of it will be easy. And of course, one area which we missed out was sterilization and disinfection. So they had asked about autoclave machines. How do you do this? Phaco probes, the sleeves, that thing they had asked, which we had missed out. So I couldn't answer. So that's one area which you should focus, is what I feel. And I think that's it. Most of it has been covered by the previous speakers. And one more thing I would like to add here is regarding the IOLs. If you have a lot of IOLs in your practice, and then it would be wise enough to read the papers that come along with the IOLs. It shows the models, it shows the optic diameter, it shows the haptics, the material, the sizes in which it comes. Let's say, for example, routine torics come up till 6, but then if you have a KC image that's showing 14 diopters and your refraction is showing around 12. So custom toric IOLs, then you have to go which company that gives. So that kind of gives an edge if you read through the IOL boxes that show the properties, the characteristics. I think that's it from my side. So I don't have any presentations, but these are some handy tips which I would like to give for the people who are going to write it in 2026, sir.
Okay, thanks, Dr. Prashant Reddy. That was amazing, and congratulations to
Thank you, sir.
So
Thank you,
I
sir.
think we'll just go to our last speaker, and then we'll open the session to the audience if they have any more doubts. Dr. Yugandhara, are you there?
Yes, sir. Good evening, sir.
Good evening, good evening. So Dr. Yugandhara is a consultant in Mumbai, and she has done her FAICO Refractive Fellowship from Netradhama, Bangalore. and she will talk a little bit beyond cataract. So she has recently cleared a FAICO FAICO refractive. So whether it's FAICO refractive or just refractive or
So just refractive. I'd applied for refractive.
okay,
Yeah.
please tell us about your journey and some tips for us to how to go about it.
Sure. So, good evening, everyone. Thank you, Dr. Anuj sir, for giving me this opportunity. So, basically, the entire refractive FICO preparation was mainly based on certain books, and I would say more of on the clinical experience that I had during my fellowship. So, I would ask everybody mainly to see in the OPD, whatever they're seeing in OPD, whatever they're practicing during the fellowship or during their practice in the OPD is something that will definitely help everybody because that helped me. Right from the theory to the practical, I would say 80% of the exam was practical based or case scenario based. So I had taken guidance from definitely my mentors, Dr. Sri Ganesh, Dr. Supriya ma'am, Dr. Savio sir, who are my mentors in Netradhama and rest of the mentors too. Dr. Prasanna, he had also like provided with certain material. A very big thank you to Dr. Arnav sir. So Dr. Arnav had also made a video with Dr. Anuj sir, I think some 5-6 months back. That was definitely on refractive, purely on refractive surgery. And it also had some tips on retina too. So Dr. Arnav had also provided me with the list of certain books and list of certain topics which I should be concentrating on. And that particular video moreover had helped me a lot in the preparation. So I would ask everybody who is preparing for refractive per se to go there and look for the video because not a lot of sources are available on refractive surgery preparation. Also, eye focus videos that helped me a lot while preparing. Um, I would also say that there were certain things like cornea based and certain things cataract based. So it was kind of intersecting between all the three branches. So yes, there were certain cases like cataract surgery post refractive or refractive post cataract, multifocal IOLs, monovision. So even these things are something that are included in refractive surgery and also in cataract surgery. There were certain cases like keratoconus, PMD. So what kind of decision will we be taking? So refractive surgery is not just about surgery or surgical technique, but it is more about planning. Who is the correct candidate? How do we go ahead? What are the different scans? What are the different commercial names for certain procedures, for smile, LASIK? And I would also say that pentacam. So these things are something that we need to concentrate on. Corvus ST, certain newer things, newer advances that we need to focus on. So the overall experience of FAIC was really good. It was more of practical based, I would tell. Yeah, overall it was a very good experience, and I would definitely tell to again go back and listen to video of Dr. Arnav, who had done through clinical peanuts, the video which he had spoken about refractive surgery preparation.
Okay, thank you, Yugandhara. And
Yeah.
so I think we'll just open the session to the audience if anyone has any questions because we have our speakers who are still there. So if anybody wants to ask any question, can please go ahead and take the mic if there are still any doubts. So I'd like to ask regarding this cataract exam, do you feel that the theory part is the one which is a little more difficult or the preparation needs to be more for the theory part or the Viva part? Dr. Samir?
I think the Viva, I think the Viva part, sir. Because theory, I feel like it was relatively okay, although the cutoff was quite scary. 75% cutoff is a pretty much high, but still, I felt the examine. If you're like read well, I think it's easily doable. But the practical can go in any way. So I feel the OSCE and the practical was relatively, they'll ask you a lot of clinical scenarios. They'll ask you a bit of refractive as well. And it was, I felt the OSCE was also not very limited to cataract. They dived a bit into other specialty, like multi-specialty care. For example, patient is having diabetic macular edema, which lens he will choose. They asked about nitasodil. They showed a bit of specular microscopy, asked coefficient of variation, and so on. So I feel that was relatively a little more difficult when you compare it to theory.
Okay. Dr. Utkarsha and Dr. Prashant, would you also agree, or would you like to add
For
something?
me, I would like to slightly disagree because I felt ki theory was a bit harder for me because I have left like the studying part, the MCQ part we have left for like 2 3 years back. Even for MS, we usually study for the theory exam and not for the MCQ. So these MCQs were particular, like when the femtolaser is used, which prostaglandin will be released. So it is very like if you read then you know those questions. So I felt ki preparing for the theory was a bit tougher part for me. And Viva, because I am operating, I am working as a consultant and I am dealing with all these things personally from the biometry and everything. So I felt the Viva part was easier for me because they you asked me the clinical questions only. OSCE, yes, it will be was tougher, but then Viva was more of clinical thing, like how will you manage PCR, how will you manage intraoperative floppy iris and all those things. So these things usually we know because we have managed all those things at some part of our career. So yes, I will say the theory was little difficult.
Okay. And Dr. Prashant Reddy, do you have anything different, or you agree with one of them?
I agree with Dr. Samir, sir. So
Okay.
I felt the Viva part was a bit difficult because unless you have the practical hands-on, it would have been very tougher to answer those questions. And the theory part, most of us would have read for our MS exam. So I think it makes more sense to concentrate on practicality. How do you handle patients? The pre-op investigations would make more sense and focus rather than just reading it.
Okay, so I think the conclusion is that boys find the theory part easier, and for girls it is the other way around. So we have one conclusion at least. Dr. Yugandhara, how was your experience with the practical and the theory part?
I felt both were actually equal. When it came to theory, I think there were around 65 or 70 questions, which I was confident about, I would say. But there were around almost 15-20 questions about which I was little dicey. So I was not very sure about them. Yes, there were few questions. There were many scientist related questions. Like I would say around 3 to 4 questions, or maybe at least minimum 2 or 3 are expected. As I spoke to my seniors also who had given, they told me like, yes, there'll be few questions they might ask regarding scientists. Practical, the OSCE and the Viva was more of, as I said, it was very much practical and practice based. So whatever I had seen throughout my fellowship, that kind of very much helped me. And def- uh, like whatever they were asking was mainly case scenario based, or like, okay, if a patient comes with this, what you would do. So certain things. And also I would say that FDA approval when it comes to refractive surgery, that is something that we usually don't concentrate on, which was when was a certain thing approved. So I would suggest people to even concentrate on that.
Okay, fine, fine. So, regarding the preparation, do you start preparing after you have filled the form, or is it like first you prepare and then you go ahead with the form? How do you feel one should time the preparation?
So I think I was towards the end of my fellowship and I felt that, okay, I'll fill the form. But I had personally started around like 2.5 months prior to the actual exam. And my very big, one suggestion to everybody is that whoever is giving FICO during the fellowship, I think that will be very much useful because you will be already in touch with that particular subject. And while you're doing fellowship, if you give this exam, that is going to benefit you either ways. for your FICO also and also for your fellowship. Because in fellowship, whatever you are studying, if you read the theory, that is definitely going to improve your fellowship experience too. And the practical, whatever you're applying in the FICO theory will also help you. So I think at least 2 months of proper preparation can also help you clear FICO.
Okay, I think after
Even
this,
I will, even I
yeah,
will agree with her. Around 2.5 months preparation will be enough. So better you will fill the form first and then prepare for the exam.
Yes, even that's what I did, ma'am. I first had filled the form, honestly, and then I had started preparing. Yeah.
okay. So like for refractive, you said fellowship. So for cataract, do you feel that those who are into fellowship will benefit? Like it will be more easier for them. Like Dr. Prashant or Dr. Samir, would you like to take this question, or it's more like your basic knowledge?
So actually, sir, I was more like I'm in general ophthalmology. I'm not in IOL fellowship as such. So I'm serving my bond at Irvine. So all with me, there were five fellows IOL fellows who gave the exam actually. And for them, actually, I feel it's pretty easy because you have access to all the biometers. As a general ophthalmologist who's sitting in general units, I don't have access to, I can't just walk over and see how Argos works or how iTrace works. And so I feel like usually you'll be doing your fellowship at a tertiary eye care center, for example Netradhama or Arvind or whatever institute you are at. So I feel you can just go and just play around with all these machines. So even before my practical, I just went and did one or two A scans on Argos, how it looks like, how the machine behaves, the eye trace, and so on. So at that time, I feel you have access to all these biometers and all these machines. You are more fresh with the theory part as well, because you'll be regularly presenting or be a part of different forums. So I feel, yeah, as Dr. Yugandhra told, I feel it's a better idea to give it during your fellowship.
Okay. Dr. Prashant, anything you would like to add?
So I would agree with both of them, sir. So it would be best if you give the exam right after your fellowship because you are well versed, you have the hands of doing the procedures yourself as a fellow. So it gives you an edge over scoring over other participants over there. Because if you have the hands on with, say, your MS39 or your topographer or your IOL Master 700, you know how it practically works, how it does not work, when all you want to repeat. So that all gives you another. For example, they showed me an image of capsular hooks and iris hooks. So unless you have not used it, you cannot differentiate between them, the colors and the materials they are made of. So it gives you an edge there. So I think it would be best if you give it immediately, like I gave in 2 months after my fellowship. So I think it would be best to do it like that.
Okay. So I think after this webinar, they'll increase the duration to 3 years. They wouldn't want people to go in during their fellowship. So you said this. So one has to have a practical experience with all these instruments, like someone who is in, as you said, not in a tertiary care, and he doesn't have actually access to the machine. So can just reading the theory be helpful, or one has to go through the reports, and is it how is the like OSCE and the questions, are they like case based, or they are just on the mechanism
So,
and yeah.
so actually, few questions are definitely quite practical, sir. Like, for example, they had asked me one question on how you would manage a subluxated cataract. So they had asked me each and every step from Rexis, staining your capsule, how you'll put your capsule hooks, till what degree of zonal dialysis, how many clock hours you can place a CTR. After that, what you would do. They had asked what you would check for a Sioni ring, the right and left orientation, and so on. Even the pentacams that they had showed. So I think one pentacam, although had a very high astigmatism, it was not suggestive of keratoconus. So anyone who immediately sees a pentacam, their mind sort of gets inclined towards saying that, yeah, it's keratoconus. But Yeah, I think a little bit of practical knowledge, but yeah, definitely. For example, the endothelial keratoplasty part where they had asked me which IOL you won't put in Fuchs. So that is something which I haven't done practically, but I had read about IOL opacifications and how IOL calcification can occur in hydrophilic IOL. So that was more from my theoretical knowledge than practical knowledge. But yeah, it's always better to have, like, to be honest, like at Arvind, we don't do biometry. Like doctors don't do biometry. It's done by MLOPs. But still, we have, we are familiar, little bit familiar with the machines. You can always go and access them. I made sure that I go and use them at least once or twice, do few scans, and it's always. But yeah, I think it's a mix and match of both. People who don't have access to it can also, I feel, get through the exam actually.
Yeah. Do we have any other questions for our speakers? So I think this has been pretty comprehensive, and we have answered, if not all, most of the questions. And this will definitely act as a primer to how to go about the preparation, because at times people feel lost that how to go ahead and from where to start. So let's hope that this will make things clearer. And if anyone has any doubt, then please go ahead, and I'll forward your queries to our speakers, and they'll definitely answer you. And I think we are again gonna shut down because we have not paid for the license. So we'll call off, and thank you Dr. Samir, Dr. Utkarsha, Dr. Prashant, and Dr. Yugandhar for sparing out time and being here at such a short notice. And it was really amazing. And let's hope to catch up again. Okay, good night.
Thank you, sir.
Thank you,
Thank you,
sir.
thank you, sir. Thank you, thank you.
Thank you, sir. Thank you.